So much. I feel before you even wonder what's going to be gained, I feel you should ask yourself, what are you bringing to the table? Because before you can be receptive to anything anybody has to offer, you kind of have to say, okay, so what am I bringing to the table? And so get clear about that. In terms of, let's say you've answered that question about what you can bring to the table, what you can gain, skill set, huge. You become so much more efficient at doing things that you perhaps struggled with as a student. You get to fill gaps in your learning. You get to embark on new opportunities. I'm going to speak for myself personally. For me, gynaes were very interesting, gynecological examinations, very interesting exams. But when I became I began supervising gynae examinations, you get efficient. And then you get to see, okay, this is the process, this is how I can make it better, and then you can help teach others to do that. So for me, gynaes is an excellent skill. I feel that kind of just came together in the residency. Filling gaps. You are thrown into courses where you don't really have the choice but to expand and grow and learn. You are in that role as a student because everybody goes through that process. Excuse me. But when you're on the other side of things now, you think in a different way. You learn to lean back a little bit more so that that facilitation process can happen for the students, whereby they're able to learn in a way that brings them to whatever outcome that we're looking for. The course I'm thinking of is primary care, and that helps to kind of fill those gaps. What I loved about, for example, acupuncture and Asian medicine is now when you're, for example, doing partner cases or supervising partner cases, you kind of have to think, okay, so where's the thought process of the student? And now you become a little bit more effective at giving feedback and guiding and steering, instead of saying, okay, yes, and this seems reasonable. You want to kind of just delve into a little bit about why. Why the point selection, why the herbal selection. And then you have to have that repertoire in your mind somewhere, stashed somewhere, hopefully easily accessible, but you get to compound on those kind of things. The opportunities are there to learn extra things, quite a bit of extra things. I know in terms of continuing education, as a resident, I was able to do Reiki level 1 through the college, which was really, really, really great. And then our supervisors help us to learn different things, whether it be practice management things or CBT, for example, or other things that kind of just round you out as an individual, as a person who's going to be able to help others, but also to kind of just give you a good footing as you go into your own business, really, at the end of the day. So contributing to the college, but also to yourself at the end of the day.
The majority of people, I would say, become much, much stronger, much more capable practitioners. So that's, I would say, in terms of personal improvement and personal development, that's huge. And then the other thing I think the residency really did was open up opportunities. So I feel like a lot of the business opportunities that I had, a lot of the things that have occurred in my life sort of opened up as a result of being a resident because of interactions with people and because of the opportunities to create work or to create final products that were meaningful in some way. So it was like a door opener is how I would describe it.
I mean, for students who are considering the residency program, I would say that you, like I mentioned before, you will get what you put into it. So definitely just, take care of yourself so you have the resources, the energy and the physical resources to deal with the rigor that comes with the residency program. It is different stress, but it's still stress coming out of, the 4-year rigorous CCNM program and then walking into the residency. It is certainly not easy. So it's important for you to know what you want to get out of it, and that's very individualized for each person. And so, if you have a passion for oncology, for example, then you might want to consider spotlighting that a little bit through your residency. So that might include doing research in oncology. That might include being mentored by an ND who has a special interest in oncology. It might include being involved in courses where you're marking papers on oncology, right? So if that's really what you want to get out of it, this is certainly the platform that you can do it in. I'd say it's an exceptionally individualized thing. But in terms of the residency, for myself, I felt very fulfilled coming out of it, very tired coming out of it, but very fulfilled coming out of it because I knew what I wanted to get out of it, and I mapped out goals in order to do that. And in terms of the college, the college is very supportive to your goals, and the college is very supportive to people who, you know, are willing to put the work in order to advance those goals, because ultimately your success becomes the college's success. So so why wouldn't that be aligned, right? So I think if you come in wanting to hit the ground running, the world is your oyster in terms of naturopathic medicine, because you can do a lot within the residency. It's wonderful to be within the college, you know, being able to pick the brains of people like Paul Saunders and Leslie Solomonian and Alan Vu and the wonderful professors that we have, Jonathan Prowski, you know, it's just, there's so many people at your fingertips that you don't necessarily have quick access to if you leave the college right away. If teaching is something that you want to do, then here's an excellent platform for you to do that. It's very competitive coming back, you know, and TAing or supervising. So having the residency experience and really maximizing on that experience while you're here can open doors for you for sure. You know, if you want to, you know, open doors outside of CCNM, being involved with the college can do that too. So, you know, working at other colleges or, you know, working at other institutions, whether it's universities or colleges outside of the naturopathic sphere, this is the place to gain that experience and make those connections and get it done. So really, it really comes down to what you want to focus on and where you see your career going in 5, 10 years, 15 years, whatever the case is, and then working backwards and figuring out how the residency can fulfill that, because it sure can, you know, if you make it what you want it to be. Yeah.
I just feel so like inspired. I'm just like, I gotta write down my goals. And
It's
like,
it's great. It's great. Yeah, and you know, the residency doesn't need to happen in order for, you know, you to get there in terms of your career. Maybe it's not the right place for certain people who really want to be out in practice and see their practice growing in 5 years. Then, not that the residency can't do that. I certainly have seen that it can, but it really is in terms of what you want to prioritize and where you see yourself, and can the residency be a jumping off point for that or not, and that's okay too.
Yeah, there's a lot I think that can be gained from the residency, and it's because of the fact that it's so challenging. I think that in the end you get so much out of it. It definitely pushes you, there's no doubt about it, but by the end I think I can say this, at least for all of the colleagues in my year, that all of us I think became a lot more confident in the way that we delivered explanations or even pathophysiology around disease. I mean, you go through it so much in the residency that as a clinician, it empowers you. You know, you feel like you definitely understand, you know, what's going on and, you know, the modalities that you've learned. So a huge tangible benefit is a sense of confidence and competency that you get from the residency. Another really awesome thing is the fact that you get to know so many different practitioners, and there are practitioners that used to be your teachers and used to be your professors and your TAs, and then becoming a resident allows you to have a different relationship with those people, and you get to learn so much from them, right? You know, there are professors and naturopathic doctors that have been around and practicing for 20 years, 30 years, and then when you become a resident, they're your peers, you know, and you get to kind of be in this academic institution, in this academic setting, just exchanging knowledge and exchanging experiences. So that's really awesome, because it's a great networking opportunity, I think, in that sense, and you meet a lot of people and you get to learn from a lot of people, which is really great. And then of course you have really awesome relationships with students, and I think that's what a lot of the residents come in for. At least that's what I came in for. And it's really awesome to be able to see how you can impact the lives of students, both personally and academically, because you develop relationships. And it's a privilege to be trusted and to allow people to kind of give you the opportunity to guide them. So I think that is really nice. There's a lot of intrinsic fulfillment, I think, that you get as well from the residency program.
Well, I guess a couple of things. So the residency program itself is a lot of additional training. So we get better at our PCD. OSCE 3 is not the end.
Oh my goodness.
So people pass the exam
Yeah.
and move on with their lives.
Yeah.
And sometimes we forget some of our skills, we lose some of our skills. The residency is fantastic at helping us build and maintain those skills, the physical exam skills, the interviewing skills, the primary care, the safe practice skills. And on the other side, of course, is whatever your special interest is. There are focus shifts. The clinical residents get to be a part of the focus shifts. Also get experience with patients, a wide variety of patients. The clinical residency, they've got a lot of, something like 3 shifts. One of them focused, one of them here, and one of them at a community health center. The variety of patients, the variety of concerns that they see is really, really wide. With the research residency, I still get to see that. Research skills from the research that I'm doing, learning how to do that.
Do a project from beginning to finish.
Hopefully to see it from beginning to end. And it is a larger project. Learning all of these skills around practice management, learning the skills around project management is what I actually meant to say, but practice management also. We do actually have additional practice management training, which is really nice getting started to have that support and to be able to start a private practice part-time and build from there. Teacher education and skills. Those of us who took the residency, we really want to teach. So we're offered, and we actually are supposed to take, additional teacher education to help us be better teachers, both for our patients and also for our students. And then, of course, the salary doesn't hurt. That's actually one of the reasons that I can build my practice slowly and not worry too much about the finances, because I've got the bases are covered. I can focus on what I want to do.
I think the educator and becoming a teacher, even as a doctor, now that I'm practicing, the way I can explain things, things like that, or making sure people understand things. That's been useful. And like I said, I give lots of seminars. I've worked with high school teachers as well, doing presentations or different health challenges and organizing things. I think I gained some benefit from doing the residency program to do those types of events. Do some research, but there wasn't a big research focus when I took it. So a lot of it was TAing and some speaking. And we also took a teaching methodologies course.
Oh, cool.
Which is really useful as well.
New perspectives is a huge one. I felt like as an intern I had ideas of what I thought I believed in and what I liked and what I didn't, and like a way I would approach a specific condition, or lab tests I thought were valid and ones that I didn't. And it's interesting that I had that opinion when I was just in 4th year, but how you just have these ideas, and then I could have easily graduated and maintained that, but when I was in the program this year, I had mentors who just thought very differently than I did, and it allowed me to open up my mind again and to really ask them more questions, understand why they run certain tests or the validity behind them, or why they don't prescribe something for a particular condition. And it just really allowed me to exponentially increase my knowledge around lots of different things. And it was a safe way to be able to relearn things, go back and actually research why I had this idea in the first place, and then I could still ask questions because I saw everybody every day. So I've seen these naturopaths every day, and I can continue to learn from them. So my skills have improved. So whether it's just acupuncture, confidence in my skills, knowing more about TCM theory, little things you learn it
then you do NPLEX, and then I have to teach it, so I need to learn it again. And then being able to, once you have that knowledge, you can even ask more questions and take it even further. So I think I've just developed more of an understanding of what I do, and way more confidence in what we do. And just way more experience. So again, with like teaching gynaes or DREs or seeing lots and lots of patients, I've been able to just see more of what I got a little tiny bit of as an intern.
I think when you are a resident here, you have a great opportunity to teach, and so if you're interested in that, it's fantastic. And by extension, you have a fantastic opportunity to learn. So to the degree that you're teaching, you're also learning. And so the solidifying of concepts that I brought up right at the beginning is, I think, one of the main things that you stand to gain as a resident. Just becoming a better naturopath. To the degree that it allows you to revisit basic concepts, which are probably among the most important, but also that it allows you to, if you're a clinical resident, to see a large number of patients that you hadn't seen before. And there's nothing like being a supervisor here and spending minutes rather than hours with the patient to force you to distill what's critically important. And then, which takes me back to the forest for the trees. There are maybe two main concepts that we've, I keep going back to. But to realize what's important, or to focus on what's important and ignore what's not important as a clinician. So those two things, I think, the teaching / learning, but also the perspective and the focus.
Okay. So I think that the experience is like no other. Good and bad, it's like no other. And there's definitely good and bad. So like I was saying before, you get exposed to so many different conditions and get to see different people with different conditions and different presentations, and just your medical knowledge just explodes before you, and you're sort of scrambling to gather it all up, and then you're also now, instead of learning all the material, you're now supposed to be an expert and teach this material. So you get is a big transition, and it changes your perspective. So what do I really want my students to know about this information, and what is information that is good to know but won't necessarily make or break a case if it gets presented to them, and why this information is important, and how do I teach it to someone who doesn't think like I think and it doesn't make sense to them. So you change the way you even look at the information, and then they'll ask you a question and you won't, I've never thought of it like that before. And so that has been a change of role and a change of perspective with the residency program from student to resident. And the residency, it gives you a little bit of everything. So like I said, we do audits, so we do research and also just quality control and making sure that the clinic is being safe, and we also do, again, different courses and do work on committees and all these sort of different things throughout the residency. So you learn a lot about yourself and what your capacity to do different things is, and you just continue to experience all things naturopathic and non-naturopathic, and it's quite an experience.
The biggest thing that I've learned is to be kind to ourselves. So at Convocation, the valedictorian actually said it very eloquently that as individuals in this profession, we have a tendency to sort of build walls around ourselves because we're afraid of outside judgment. So we may not want to bring on a preceptor because we don't want someone else to see what we're doing and give us feedback. And it's similar, I think, in our in the program, as you come in as a resident and you're teaching individuals, you're so afraid of making a mistake, you're so afraid of saying something wrong and to be caught, feeling like you didn't know enough or feeling like you're not competent enough. And I think in whatever capacity you are in, whether you're an instructor, whether you're a healthcare professional, whether you're a student, you'll always have that sense that you could know more or you should know more. And I think that this program, the great thing was it gives you a lot of sense of just an internal compass and allowing yourself to be patient and to learn and to make mistakes and to own those mistakes and realize that we're in a profession where we're constantly going to be presented with new information and new evidence, and we're always going to be learning, and that's just part of it. And having feedback from other individuals is immensely helpful, and it makes us better. And we're not perfect. And the more we can kind of settle into that and be comfortable with that and let go of that idea of perfection and be open to this idea of growth, the better you are personally and professionally. So I would say that that's probably one of the biggest things I've learned from being able to gain those skills in self-reflection, to being able to receive feedback from the students and faculty. I think it's just learning how all of that fits into your own growth and development, and to accept it with non-judgment and just with value. So with openness to grow